Welcome. You're watching continuing coverage of the World Healthcare Congress 2012, and I'm very, very pleased to welcome the new president-elect, Dr. Jeremy Lazarus, who is now with the American Medical Association. Dr. Lazarus, so pleased to have you here today.
Good to be here.
What are the next 2 years going to be like for you?
The next 2 years are going to be very hectic as we see what happens with the Affordable Care Act and how we're going to implement that or deal with it. If it's not going to be implemented, we're going to be very busy trying to make sure that we can increase coverage for all Americans, better the lives of physicians, reform medical education, try to look at healthcare outcomes to try to make them better for patients and the whole society that we live in.
Absolutely, and to reduce some of that cost that people are so concerned about.
Right.
Now, what is the official recommendation or commentary you've done on the Affordable Care Act?
We have given our qualified support to the Affordable Care Act and continue to support it. We've also had policy on individual responsibility that patients ought to have insurance or pay a fee into the system if they don't have it, and also if there's not sufficient income for individuals or families to be able to get tax credits to help them with their insurance coverage bills.
Okay. Are you discouraged at all that come June all of the ideas behind the act or your recommendations may be canceled out because the Supreme Court might vote that this is unconstitutional?
Not discouraged yet because we don't know what's going to happen, but a number of the insurance market reforms that are related to the individual mandate would be very difficult, if not impossible, to initiate and go forward with without the individual responsibility piece.
How fast is the pace of change happening right now? Do you feel that people are collaborating and getting things done?
The pace is very fast right now with the new affordable accountable care organizations that have been approved. There are 27 just about a week ago. We're moving towards more team-based care, more integrated care, different forms of delivery of care that we give, different forms of payment that we're experimenting with. It's a pretty rapid change right now going forward. You
mentioned 27 just approved last week. What is the process like?
There's a process of application. You have to have a certain number of primary care physicians. They need to have, they don't necessarily need to have a hospital associated with them, but they have to have a certain number of patients attached to those primary care physicians, and they have to have the necessary infrastructure to actually develop the accountable care organization. And luckily, the CMS has provided about $170 million in startup costs for a range of these, and that helps to get them going. So.
Is the patient on the ground going to notice any of these changes going on behind closed doors?
They will be informed and have the opportunity to say that they wish to participate in the ACO, the Accountable Care Organization, or not. So they will be informed about that. At what point, I'm not exactly sure, but they will be informed.
Sounds like you have, as you said, a very hectic 2 years in front of you. What else do you hope to achieve over that time?
Well, we have a couple of big issues, outstanding issues that weren't part of the Affordable Care Act, and one was the Medicare payment crisis, where we've had to fight every year to just keep Medicare payments stable. And you know, we know that physician costs go up in terms of the overhead, just taking care of a practice, paying staff and so on, but unfortunately Medicare payments have stayed relatively stable over the last 10 years, so we can't actually keep up with costs. So we'd like to see the Medicare payment formula repealed. It's called the sustainable growth rate. And we'd like to see a period of 5 years of stability in payments so that we can experiment with some of these new forms of payment that I mentioned, like bundled payments, shared savings, accountable care organizations, and then you know, to be able to move into new forms of payment that are better. The second piece, the big piece that wasn't in the Affordable Care Act was the medical liability issue. We'd like to see laws similar to the ones passed in California and Louisiana, where there are caps on non-economic damages, and we're pushing that in Congress right now in a bill called H.R. 5, which passed the House of Representatives.
Does that have a good chance of getting pushed through?
It passed the House, and we're looking forward to seeing what happens in the Senate.
Okay, well, very good. Thank you so much, Dr. Lazarus. Good luck over the next your term. I'm Abel Jong. Thanks for watching.